I'm Wilfred Venderik. I'm radiology resident and researcher in the Radboud University Medical Center in Nijmegen, the Netherlands. And me and my colleagues wrote an article which is called mpMRI and follow-up to avoid prostate biopsy in 4,259 men. The first aim of our study was to determine how many men avoid prostate biopsy because of a negative mpMRI. The second aim of our study was to determine how many men developed clinically significant prostate cancer after they had a negative mpMRI. So we made a database compiled of patients who had an mpMRI in our hospital within the last 6 years. Patients had a history of either a negative trus biopsy or they were biopsy naive. All patients had an mpMRI in our hospital classified by one of our 8 in-house trained radiologists according to PIRATES version 1 or PIRATES version 2. And based on the inclusion criteria, we were able to include 4,259 patients, and approximately half of them were biopsy naive and the other half had a history of negative trus biopsies. The most important result of our study is that 2,281 patients avoided prostate biopsy because they had a negative mpMRI, which is 54% of the entire cohort. And the second result is that the clinically significant prostate cancer diagnosis-free survival is 99.6% after 3 years. So only 0.4% of patients developed clinically significant prostate cancer after they had a negative mpMRI. And this underlines the importance of mpMRI in the workup of patients who are suspected of having clinically significant prostate cancer. Yes. My study is unique because it included the largest cohort of patients who had an mpMRI, which is nowadays published. And it's unique because we had a real clinical setting. So patients had a clinical suspicion of having prostate cancer, and we just made an mpMRI to see whether we detect clinically significant prostate cancer within that prostate. Of course, we are aware that our hospital is a prostate MR center of excellence. There is a lot of experience with prostate MR reading in our hospital, so it's not easy to transfer our results to other hospitals, but at the end everybody can learn how to read prostate MR, but they have to have good training and they have to see the biopsy results after they read the MRI, so they can learn from their own biopsy results, and those two things are very important in my opinion. The message of my paper for patients is that if they have a good quality mpMRI and good radiologist, they are able to avoid prostate biopsy. Whether it is their second biopsy or their first biopsy, they can avoid prostate biopsy, and that is very important. My message to urologists is that patients can safely avoid prostate biopsy by using mpMRI, because the clinically significant prostate cancer diagnosis-free survival is very high. So there is a high negative predictive value. So you can just safely tell to your patient that the mpMRI is negative, and that they don't have to worry about clinically significant prostate cancer.